And with something as massive as the Affordable Care Act, there are a lot of myths, a lot of rumors going out there associated with the law.
Yes, and now we want to put some of those to rest. News 10's Jeff Maher joins us in studio with those details. Jeff.
Good morning. There are so many myths flying around with this new health care plan that the White House actually dedicated a section of its website to set the record straight. It's titled Myths and Facts, and they address many of the rumors that so many people believe to be the truth. There are plenty of misconceptions about the Affordable Care Act. One that comes up a lot has to do with Medicare.
And whether or not individuals that are already at retirement age receiving Medicare benefits, if they were going to be able to receive assistance paying those premiums. The simple answer to that is no, they're not.
Another myth is that people on Medicare will have to buy additional insurance. They don't. Under the law, if you have Medicare, you already have insurance. Another issue has to do with exactly how much businesses will suffer as a result of government health care.
It's the biggest job killer in the country.
The White House tries to debunk that common statement on its website by saying, quote, health insurance reform lowers costs for American businesses, especially small businesses. It goes on to say that many businesses could pay 3 to 4% less than their current premiums. Speaking of cost, many Americans are worried that being forced to buy insurance will make them go broke.
We have heard from various insurance carriers on the individual market. Rates could go any place from 60 to 120% higher than the current market.
Well, according to Covered California, you could qualify for financial help depending on your level of income. Also, the government won't be telling you which doctors you need to see. The insurance sold on the exchange comes from private companies, and each individual plan has its own network of doctors and hospitals. And the White House also makes clear on its website that your tax dollars will not go to pay for abortions. There are many other myths and debunked information listed there. It's whitehouse.gov/health reform. And coming up in the next half hour, I'll be talking about the scams and the scammers to watch out for. There are plenty. Guys, back to you.
Thank you, Jeff.
You know there are going to be scams out there.
Yeah, and this is the moment when the identity thieves seem to strike. Jeff Maher joins us now with what you need to look out for. Jeff?
Yeah, you know, there's a lot of confusion over this, and with confusion comes scammers, and with scammers comes a lot of people who could be taken advantage of. So here are some things to keep in mind from Covered California and WebMD. The first thing to look out for are these urgent emails that you may get telling you that you could face prison time if you do not get health coverage immediately. Under the Affordable Care Act, most people do need health insurance, but the penalty is not jail. Next year, it's 1% of your income or $95, whichever is greater. Remember, even if the email looks legit with state seals and other official emblems, do not give any of your personal information, do not reply to it, and do not click on any of the embedded links. Another scam has to do with solicitors on the phone or at your door. They'll tell you that you're the first to get the Affordable Care Act card and that they need your social security number and bank account number. That's all they need to drain your savings. There is no such thing as an ACA card. And here are some other things to keep in mind.
Remember, another thing is don't trust your caller ID. They have something called spoofing, where you can look on your caller ID. It looks like it's coming from Social Security. It looks like it's coming from Health and Human Services, but it's just been copied by the scammer.
Another thing to look out for, fake navigators and other helpers. Such people actually exist to help people with open enrollment, but there are also fakers. If someone calls you saying he or she is from the local community center and is offering help, they could be a crook, and that person will likely ask for your personal information. Now, if you have any suspicion that a navigator is not certified, you can contact the California Department of Insurance, or you can also get a hold of Covered California. We've been showing you that number. If you have any questions about fraud, you can contact 1-800-300-1506, and the website has additional resources that has to do with fraud. You click on resources, scroll down to consumer protection, and it has a lot of information so you can protect yourself, which a lot of people will need in the months ahead.